Hi everybody. Thanks for joining. And so yeah, that's kind of a little bit about myself here on this first slide. And I've been with Allegro for wow, really, it's been that long already. And then my I do have three boys. One of them, believe it or not, I just launched, and he is now a freshman in college, which is crazy. And I have my younger two are a freshman and a junior. And then this is true about myself. I did start a little bit late, and all three of my boys, believe it or not, did the same thing. All right, so first polling question.
Looks like we have a little bit of a lag, so we'll let it
Yep,
run for just
got
a
it.
minute here and then I'll press
Sure,
share results with you, Dr. Bellarmino.
sure, no worries.
All right, you should see the results now.
Perfect. All right. So clearly, obviously, there's no right answer for this question, right? And it's very, very normal to feel all of the above. And for those of you that haven't really thought about it yet, I do think it's still important to at least understand what might be coming up on the horizon, just so you're not kind of caught off guard by it. And just kind of get more kind of a little bit personal example about me. When I was growing up in middle school, the PE was very, very different. We actually did shower at school, and the showers were not individual showers. The locker rooms were not individual stalls. You just basically showered with everybody in your class, obviously just the boys. And it became very, very obvious to me when I was in seventh grade that I was not quite as far along as some of my classmates were. So, but again, all of these feelings, whether it's kind of being nervous about it, worried about it, very, very normal. Definitely no need to be. And then obviously having a kind of let's just kind of go attitude about it is definitely a good thing to have. So first things first, right? So let's then I'm talking kind of the parents first, right? So just talk to your boys about this topic, right? And so otherwise, because if you don't do it, either their friends are going to do it for them, or they're going to find out about it on the internet and kind of try to figure out things on their own. Every single one of you has clearly already gone through this process, and since it's such an important part of kind of our life, a lot of us actually remember a lot of the details about it, good and bad. And so all of you clearly is really qualified to kind of have this discussion, right? Dad's clearly you guys have gone through this. The exact same way your boys are gonna go through it. And moms, you went through it very, very similar. Obviously, some things are very, very different, but a lot of it actually is quite similar. And so you guys are just as qualified too. And so, kind of some of the advice I give to parents, kind of if and when you kind of feel ready to have this, is just kind of practice it either in your mind or literally like you were getting ready for a presentation at school in front of a mirror. Just because the more you do it, the more comfortable it becomes. It's probably a lot easier to just use the right terminology, right? Don't dance around. If you had kind of little cute names for things before, it's just kind of better to just get comfortable with these terms and, try to get all the giggles out. They're going to laugh, but if you kind of just be a little bit more direct about it, it just makes the conversation a little bit more easier. One of the biggest kind of recommendations I have regarding this topic is it shouldn't literally just be one talk and then I'm done, right? You don't just sit here and like say, okay, let's just talk about this for 20 minutes and then never bring it up again. It's kind of more of a kind of an ongoing kind of discussion of things as things kind of come up. And that's probably just an easier way to kind of approach it. Um, and then, if you do engage with your kids, with your boys about this topic, they're going to feel way more comfortable about being willing to ask you guys questions, right? If this is something you've never ever talked about in your life and you seem super awkward and uncomfortable about it, if they have questions, they're going to go somewhere else because they know it kind of gives you guys kind of the heebie-jeebies, and then they'll try to go kind of find out information kind of on their own. And it might be good information, it might be terrible information, and so it's probably better that it comes from you guys. All right, so I'm going to date myself. Kids, I clearly have no expectations for you guys to know who these guys are. This is a group called Boys to Men. They were kind of it's still kind of around, but they were big in the 1900s, the late 1900s. So what is puberty? What is adolescence, right? So in general, you think about puberty as kind of the period of time where your body physically goes from that being of a boy to that of a man, right? So it's kind of like a transition or an in-between period, if you will. A lot of the times adolescence kind of gets used kind of almost interchangeably with puberty, but it's actually a little bit different. Adolescence is kind of a more of a broad, kind of bigger term. Puberty is kind of more related to the physical kind of part of it, where adolescence does include puberty, but it also includes like the non-physical stuff, like the changes that happen in your behavior, your feelings, your emotions, and things like that. Okay. All right. So I think we got another poll question coming up. Oops. All right, so that was an easy one, right? That was clearly you can see my interest in Star Wars and comics. But yes, it is hormones. And so, what exactly are hormones? So, do you need to do you any of you boys need to do anything to kind of make puberty get going, right? Do you need to do anything, eat anything? Like, no, it's just going to happen. Every kind of instruction is already kind of encoded into your brain. And then when the time comes, your brain's going to send these chemical messengers and to there's a tiny little gland underneath your brain. It's about the size of a bean. It's called the pituitary gland. And then what's going to happen is when the pituitary gland, excuse me, gets this signal, it's going to start secreting these chemical messengers, and that's what the hormones are, right? And they go into your bloodstream and they travel everywhere. They go all over the body, and depending on where they end up or what they are interacting with is depending on what their role is going to be at that particular kind of endpoint, right? So for instance, like if these hormones get to your testicles, that's their testicles in turn are going to start producing a hormone called testosterone, right? So and then it's again the role of the hormone is going to be different depending on what the kind of the target organ is. So when does puberty start? Totally different for everybody. You're probably going to hear me repeat this several times during the presentation. It is super, super variable, right? In general, though, girls are definitely going to start puberty about 1 to 2 years before boys. So that's why you're going to notice around fifth grade for sure, sixth grade, a lot of the girls in your class they're either have gotten already a lot taller than you guys, start to develop a little bit faster than you guys, and that's kind of why you kind of notice that is because the girls will definitely in general start puberty well before boys, years kind of before boys. Most boys, it's actually going to start somewhere between 10 and 12 years old, but believe it or not, it can start even as early as 9. There's definitely some ethnic kind of differences in that start time, but in general, it's going to be somewhere around 10 to 12. But on one hand, we can be early. On the other hand, it can also be quite late. So some kids might not even start the process until 14 years old, when some of your friends are already deep years into puberty. You might just be starting, right? So a lot of it of kind of like the when you start, a lot of it has to do with your parents. And so a lot of times I get clinic visits about, hey, my kid's starting puberty late, or I haven't seen any signs of puberty. When is the growth spurt going to happen? My first question, always, 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 is going to be when did the parents start puberty? Because that's going to play a big role in when the kids start. Um, and so most boys are done with the physical changes by that time they're 18. But again, obviously that does depend on when it kind of started to begin with. All right. So, aging myself again. This clip is from a movie called Big. This is played by Tom Hanks. He before literally the night before he woke up in the scene. I want to say he was like 11 or 12 or something like that, and he made some wish, and then he woke up and became a grown man. And so he is admiring the changes here of that change. So. You actually, believe it or not, won't know when you started, right? Because a lot of the physical changes that boys think about when they think about puberty, those are actually puberty had actually started a year or so before, right? So one of the subtle changes is the first actually physical sign is enlargement of the testicles. So unless you're really kind of keen on how big your actual testicles are, it's unlikely that you're going to know that they're actually starting to get a little bit bigger. And then that usually happens sometime after you turn 11. And then a few months after that, typically by the time you're 12, you'll start to notice your first pubic hairs. And then just a kind of a note about that. Some younger boys have really soft, kind of fine hair above the penis and the pubic area. Those actually aren't considered pubic hairs. Pubic hair is going to be a lot more different, typically a lot thicker, typically a lot darker, a lot more curlier. So a lot of times parents will be a little nervous about their young kid having pubic hair, but in reality, it's just really soft, fine hair, similar to the hair that's kind of on backs or on arms and things like that. And that typically isn't pubic hair. And then typically around 13 to 14 years old, you start to have hair on your armpits. Your voice might start to change, get a little bit deeper. And we'll go into some of those changes a little bit later in the presentation. A little bit of a busy slide, but the big thing I want you to kind of take the takeaways are that girls, again, typically start way earlier. You can see kind of these lines start way at kind of a younger age, and the boys tend to start a little bit later. And then these kind of the color is kind of like how long the changes kind of happen. And so you can kind of see that 18 pretty much you're pretty much done, but then there's this progression of kind of the order of things. And they typically most boys will follow kind of the same order of things kind of happening. All right. Obviously, no talk about puberty can not have a picture of penises. So here we are, and so this is kind of showing you kind of the differences in kind of hair patterns. And so when you're pre-pubertal, there's essentially no hair, and then as you kind of start increasing, just tiny little sparse hairs, a little bit more kind of dense, a little bit thicker, and then obviously by the time you're an adult, just usually typically a lot more kind of thicker hair. And so everybody has different kind of patterns. Some are really kind of sparse, some is really dense, all very, very, very normal. Okay. All right. So okay, so after your pubic hair appears, your testicles are going to continue to keep growing in size, and the skin of your scrotum is going to get a little bit thinner, a little bit more wrinkled looking, right? That's just kind of the progression of changes in your scrotum. Your penis is going to start to get a little bit longer, a little bit thicker, right? And then since we're on the topic of penises, they all come in different sizes, right? But they're all going to function exactly the same. The bottom line is, penis size is going to be a source of jokes when you're kids, when you're a teenager, when you're in college, when you're an adult, right? That's just kind of how it is. But I'm telling you right now, they're all function exactly the same way. Some penises are about the same size, whether or not they're soft or erect. Others literally like almost double, maybe even triple in size from a soft penis to an erect penis, right? So it's very, 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 very variable. All right. So speaking of erections, believe it or not, boys, you guys have had erections your entire life, even when you were a baby, even when you were a toddler, right? When you were younger, they usually only kind of happen when your penis is either rubbed or touched in a kind of certain way. During puberty, however, things start to change a little bit. They're gonna happen a little bit more often because not only will your penis become erect when it's kind of touched or rubbed, it's also going to be a little bit more sensitive to like even thoughts and things like that. So very, very normal. So unfortunately, you will also probably start to have erections in times where you really, really, really don't want to have an erection, like at school. But it's all right, not to worry. Most of the time, it's covered by your clothes, but it is just kind of part of going through puberty. Okay. So what kind of physical changes to kind of expect that are, that are very, very obvious and kind of you can see and observe and feel, right? So the hormones, those chemical messengers that I talked about earlier, will also cause your larynx. Another word, a term for that is your voice box, to grow larger and a little bit longer, right? So this is the reason why your voice might get a little deeper. And as your voice is going from less deep to more deep, that's when you start to have your cracking of your voice, and it'll just kind of come out of nowhere. It might be during when you're speaking out in class, but again, it happens to everybody, and it only lasts just a few months, so it's not that big a deal. Physically, you see this change as what people call your Adam's apple, right? So that kind of bump right on your throat, right? And so this is a picture of my middle child. This is us at IKEA, and we're actually in a restaurant, at the restaurant, eating Swedish meatballs. And my son was asking me if I got a meatball stuck in my throat. So that's what this picture is. All right. Um, all right, so probably without question, the most common questions I get during clinic is, how tall am I going to be? Okay, that is, sometimes I even just get visits just for that alone. It really, really, really depends on kind of how tall your birth parents are. And in general, again, it's a very broad generalization. Boys tend to be closer to their birth father's height. But obviously, there's a lot of kind of things that can go into that. If there's height in the distant family, uncles, cousins, grandparents, that can clearly kind of sway things. If there's a huge discrepancy between dad's height and mom's height, that can definitely change things a little bit. And one thing again, kind of going back to this again that I mentioned before, the timing of your growth spurt is really, really variable, right? So if you're quote unquote a late bloomer, your friends are going to start puberty a lot sooner. They're going to hit their growth spurt sooner. So they're going to get tall, right? So people in your class, you might feel that were already taller than you and now have left you even more because you haven't really started yet. But in general, they're going to stop and it'll be your turn, and then it'll be your turn to kind of catch up, right? So again, a lot of that has to do with when your parents kind of hit puberty. So that's, again, that's the first question that I ask is when that discussion comes up, is trying to figure out what the kind of the family history is. Your body kind of composition will change. You can actually have the ability now to actually start putting on some lean muscle mass. So if you were pre-puberty and you did all the push-ups and all the pull-ups and until you couldn't do anymore, you're actually not going to put on a whole lot of muscle. You can get a little bit stronger, but you're definitely not going to put on muscle. But once you kind of start getting deeper into puberty, that exercise, that resistance training will kind of start to lead to kind of like actual real muscle growth. So this next slide, I apologize for the busyness, but I'll try to kind of walk you guys through it. So let's just don't focus on this down here, just kind of focus on this and focus on the solid lines rather than these dashed lines. So the solid lines, is black line is kind of the average, kind of like the growth kind of velocity. So right around, like I said, 11, 12, 13, you can kind of see the slope just pick up a little bit. And then around 15, 16, 17 slows down a little bit, and then pretty much flat by 18. So that's kind of the average, right? And so if you were let's say an early bloomer, that's this blue line. Imagine this blue line was kind of right now, right on top of this black line, but then you started your growth spurt earlier. Now you're kind of up here, and now you look how much taller you are than the average kind of kid. But then if you started earlier, you're probably going to stop earlier too. And that's kind of exactly what happens here, right? So they stop earlier. Everybody else who started a little bit later, or quote unquote on average, is now caught up to you guys. And now you essentially end up at the exact same place, right? Same thing with the green. So the green, again, just imagine this right on top of the black line, and it's everybody's kind of tracking. And then, oh, everybody else started hitting their growth spurt, but you have not yet started yet. So now look at this gap down here. You are so much more shorter now than everybody else. But they're going to start slowing down, and you will start to hit your growth spurt, and you will eventually kind of catch up to them. So, I've had stories of parents, dad still growing first year college, right? And that's really, really late for boys. So again, in general, genetics largely determines what your kind of adult height's going to be. clearly there are some abnormalities in height. And so if the shape of your growth line, your curve here is flat, or it starts flattening out, that could indicate a problem. And those are the kids that we end up doing a little bit of a workup on. All right, another poll question. Okay, so it is going to be all of the above, okay? So here's a little bit more of kind of things to expect. So remember those hormones that I kind of talked about? So they're also going to go to your skin. And so when they get to your skin, it's going to cause a little bit more oil and kind of sweat production. And bacteria love sweat, and oil is kind of what they feed on. And that's what tends to lead to body odor, right? And so your armpits, your groin, your feet are perfect environments for a bacteria to grow. It's just damp. It's kind of always covered. It's a lot more warmer than other parts of your body. And so this is what causes body odor, right? You unfortunately might not realize how strong your body odor is because you essentially get what's called nose blind to it. You're just so used to the smell, you don't smell anything. So people around you, however, may notice it. And so please don't take offense if your parents, if a sibling, a friend, a teacher kind of reminds you, it's like, hey, we might need to take a little bit more frequent showers, start using some deodorant, right? Again, you may not understand why because you don't smell anything, but that's just because we're so used to our own smell that we may not notice it. All right. Acne. So this oil production is also the reason that we get acne and pimples and zits, and obviously bacteria are involved in this as well too. So what happens is oil and kind of the dead skin, it blocks your skin pores. And those are tiny little holes in your skin, and things get just basically trapped. So if things get trapped, if the blockage is kind of deep into the pore, it can lead to a lot of redness, and bacteria fill it up, and that's what causes the pus. And now you have a pimple, or you have a kind of an outbreak of acne. And if the blockage is way close up to near the surface, that's what causes a blackhead. So it's not as red, it's not as irritating, but it's what causes those kind of hard black kind of discoloration at kind of the tip of your skin. So kind of how bad your acne is kind of really depends on how much kind of oil you produce, and that's kind of different for everybody. And having acne has nothing. It's not a sign that your face is dirty. It's not a sign that you don't clean yourself. It's just it. But cleansing is part of kind of reducing the bacteria and the kind of the debris on your skin. So it does help to control acne a little bit, but it doesn't necessarily mean your face is dirty or you're not taking care of your skin. If it's really bothersome, I definitely encourage you guys to make a visit with your doctor. There are some over-the-counter treatments that you can try first for some mild acne. Over-the-counter, the strongest strength benzoyl peroxide. You do that kind of once a day, and then the opposite end of the day, you do like Differin, and that used to be prescription, but it's not anymore. The generic is for that is called adapalene. But if that doesn't seem to be working, then I would definitely make an appointment and have that discussion. The first question I always ask when a kid comes in for acne is, how much does it bother the kid? Because a lot of times it bothers the parents way more than the kid. And the reason if I ask the kid is they're the ones who have to do the treatment. And if they're not motivated, there's no point in kind of treating it. And so definitely ask your child how bothered they are kind of by the acne. It may not be that big a deal for them. All right. Here's some kind of other physical kind of things as you go through puberty. So one of probably the most bothersome is something called pubertal gynecomastia. And so it's essentially kind of male breast tissue, right? And it happens just in about 33 of boys, typically around 13 years of age. It can last as short as 6 months. It can last as long as 18 months. Usually both sides, but it can just be one-sided. Can be pretty tender when you touch it, but in general, it doesn't really hurt. But it's just more of a kind of a just hard to, kids don't want to take their shirt off anymore because they have these kind of bumps on under their nipples. But a very, very common thing that some boys kind of go through, but it does generally go away. This is called Osgood Schlatters. This is a knee, if you can't tell. This is a leg, and this is the lower leg. And so this is called Osgood Schlatters. And what happens is as you guys grow rapidly, there's tendons that kind of pull on this part of the bone, and it just stretches and pulls and pulls and pulls, and then it leaves to this kind of bumping of the bone here. As this is happening, it's super, super tender. It's pretty miserable to touch, to kneel on. Some kids struggle during sports and playing and things like that. So, but it does go away, and it is temporary. This is it's called Sever's disease, and so it's essentially the same kind of thing that's happening in the knee, but just on the ankle. So this is just pulling and yanking on this part of the heel and the growth plate, and it can cause a lot of discomfort, especially in your more active teenagers that are going through puberty, the runners, the jumpers, and things like that. And so there are certain things that we can do to kind of minimize the pain if that's happening. So you can definitely make an appointment, and we can talk about that if you need to. All right. So what will it feel like as you go through puberty, right? So, this is, I'm just gonna lie, this is probably one of the more awkward kind of topics to talk about during puberty. But let's just get it right into it. So under the influence of testosterone, your testicles are going to start producing sperm. So sperm is the male reproductive cell, right? It contains like half the material to help essentially make another human being. So when after leaving the testicles, the sperm in your body, right, in your testicles, when it leaves the testicles, the sperm mixes with a lot of other fluids in some other glands, and together that all makes semen, right? And so at some point during puberty, right, your body's essentially going to practice ejaculating or shooting the semen out of your penis, okay? So the good news is it usually only happens when you're sleeping and when you're dreaming. And so that's why there's this term called the wet dream, because essentially you're wetting your pants while you're dreaming. The medical term is called nocturnal emission, right? But you're going to hear about it called a wet dream. So there's, by and large, you won't even know that you had one until you wake up that morning and you're going to be like, what is this weird, dry, crusty stuff in my underwear? That's just the wet dream or that nocturnal emission that we're talking about. Some boys just have a few of them their entire kind of puberty period. Others have them a lot. There's really nothing you can do to make them happen or not happen. You just kind of do, okay? And so again, this is a little bit less physical than more mental part of kind of puberty. At some point, you're probably going to start getting attracted to people that you weren't really attracted to before. It's just kind of an upward kind of change. You're going to see them a little bit differently. It might be somebody on the internet or on the TV or in your class. You're going to start to notice different things about the people in your class or at your school, the way they look, the shape of their bodies, the way they dress, the way they smell. All these feelings are super, super, super normal, okay? Might be a little weird at first, might take you a little bit aback at first, but very, very normal. And kind of, again, when this kind of starts is different for everybody. So you and your buddies, you might have a kind of circle of friends, and then kind of one of them might start to get a lot more interested in the opposite sex a lot sooner than you, and you might not understand why they want to go start hanging out with this other person rather than you. And again, just you may not understand it, but again, everybody's just gonna have their own kind of time schedule for this, okay? All right. So don't be surprised, right? Given all these crazy changes that's going on in the body and the brain for parents, is for you guys, that kids could get a little bit more emotional than usual, right? A little bit more irritable, a little bit more frustrated, right? And so just remember, your teens are trying to kind of got to get that sense of independence and kind of gain their own identity. And so it's very, very natural for you guys to have a little bit of friction around this time. They're trying to figure out who they are, right? And kind of what their identity is, and their friends are also going through these changes. And so don't be surprised if their friendship circle starts changing and things like that. All very, very normal stuff. Okay. All right. I think this is the last poll question. All right, so the answer is actually mid to late 20s, so 25 to kind of 28 years old, okay? That's when it kind of fully matures, right? So what in the world is the frontal lobe, right? So the frontal lobe is kind of the part of the brain that deals with executive function, right? And so it's that ability to make rational decisions. It's involved in emotional kind of situation, that planning, and kind of like the right and wrong, decision making, choice making, that kind of stuff. And so during this, because their brain is not quite mature, right? They're very, very, very susceptible to peer pressure. They are 100% going to gravitate towards behaviors that reward them in some way, shape, or fashion. They're super focused on instant gratification, and they don't really have much consideration of consequences at this time. Okay. All right. So, I could probably spend a whole different topic on nutrition, on daily physical activity, on sleep, right? And so and then the problem is, to compound the problem, is teenagers, don't want to be told what to do, don't want to be told how much sleep to get, about when to go to bed, about what better things to eat, about staying active. But this is super, 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 super important, right? And so just they're going through a lot of physical and kind of mental changes, and just having a well-balanced diet, good nutrition, a daily physical activity, right? And then a good amount of sleep. The problem with sleep is that teenagers biologically want to stay up later. That's just natural. There's no fighting that. The problem is now, this day and age, we have dozens of things that kind of make them want to stay up even later, mainly like screen time and things like that. So please, 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 please make sure your preteen boys and definitely your teenagers are getting enough sleep. We can't control what time they have to get up for school, to get ready for school and all that kind of stuff, but we can have some level of control about what time they start shutting things down and getting ready for bed. All right, so these are just a couple of references. This is probably one of my favorite books. This is actually based on the people who do the Great Conversations talk at Children's. I think it's now all virtual. It used to be like an in-person class, but I think COVID changed that, and now I believe it's in person. But it's one side's for boys, one side's for girls. Great. It's a question and answer style book. Really, 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 really like it. And then the other one is, this is actually the only book about puberty that the American Academy of Pediatrics recommends. It's called Uology. I actually haven't read it. I've kind of flipped through a little bit, but it's more of a kind of a reading kind of chapter kind of style. So if that's your jam, then I would probably go for this one. And that's it.
Awesome. Thank you.
Yep.
So we've only got a few questions here, so I'll rapid fire them to you.
Yep.
The first one is, when or how do you know when deodorant is appropriate?
Yeah, so deodorant essentially is you can even use, I've had kids use deodorant even before they start puberty, right? So again, if there's enough bacteria, if it's dark and if it's damp enough, and they just, for whatever reason, an 8-year-old's armpits smell, it's okay to use deodorant. Now, the younger they are, I definitely recommend the kind of the more minimal kind of ingredients kind of deodorant. So Tom's is kind of a popular one among the younger kids. You just got to try it and make sure it doesn't irritate their skin. But definitely once they start, whether in that 12, 13 for sure, if they're the kind of kid that tends to kind of a little bit more odor, that 100% should be kind of using deodorant at that time.
Great. Next question is there a way to tell how tall I will be?
Yeah, so the most kind of I want to say the accurate, the best way that we have. It's not perfect, but the best way. It's called. You can actually look this up and just there's probably online calculators that do it. It's called the mid parental height calculator. So all you need is your mom's height, your dad's height, and then you just plug those in. It'll kind of tell you within like it's like a guesstimate about 1, 2 inches about where you're likely to be genetically. I've seen that be way, way, way off, but by and large, it's pretty dang close to what your kind of adult height is going to be. Again, there's some variables that can change that. If you're not gaining, like I said, if that curve is flattening, those are the times that we need to do like a workup and things like I've had kids with like celiac disease, thyroid disease, growth hormone deficiency, right? Those are the kind of things that will kind of not let you reach your kind of genetic height potential. But if you want to kind of a guesstimate, the mid parental height calculator is probably the most accurate.
Great, thanks. And then our last question here is about when facial hair will grow in, and if your dad has facial hair, does that mean you will have facial hair as well?
Yes and no, right? So for that second part of the question, so it's more personal for me again. I have very like I don't know, you can't really see. I have like almost no hair in my arms, like nothing, right? I have an 18-year-old. He is hairier than I am on his face, on his arms, on his legs, his armpits. And that's probably on his more his mom's side, right? On the side of the family. Not his mom, but his mom's side of the family. He inherited those genetics from his mom. And so it's quite variable. As far as when it's going to kind of show up, probably again that kind of 11, 12-ish probably to kind of 15 kind of range is kind of the most likely period where you actually start seeing it a little bit thicker, a little bit more coarser, a little bit more noticeable.